Let's get you the latest numbers with regards to the coronavirus. But remember, the National Coronavirus Command Council will meet today to assess the developments with regards to the COVID-19 pandemic and the country's national response. The council's deliberations come towards the end of a 2-week period during which the country implemented alert level 4 of the coronavirus national state of disaster. The council meeting will be followed, we understand, by the meetings of the President's Coordinating Council and Cabinet. Latest numbers, there are now 21,610 new COVID-19 cases that have been identified in South Africa. Further, 265 COVID-19 related deaths have been reported, bringing the total fatalities to 64,138. Active cases have meanwhile increased to over 211,000. All right, I want to get the very latest in terms of our fight against COVID-19, the level of concern from scientists as well. The acting executive director at the National Institute for Communicable Diseases, Professor Adrian Puren, is live now with us to give us the state of play with regards to South Africa's fight against COVID-19. Prof, always a pleasure having you on the program. Welcome.
Thank you, Ben, and good morning to your viewers. Thank you.
All right. So as the number of infections and the number of hospitalizations increase, so has the number of fatalities. We are losing, Professor, our loved ones at a rate that for some it's too much to bear. Your level of concern at this stage of South Africa's fight against COVID?
Yes, so I think we're still very much concerned. You've just emphasized those particular points. As you can see that overall, the numbers have certainly outstripped the second resurgence. And that's going to be ongoing as we look at the various graphs and the data. It would appear that Gauteng may well have reached its peak, but remember that that's at a very high level in terms of the actual numbers per 100,000. So even though there's going to be declines over the next few days and weeks, I remember that's coming off at a very high level in terms of the numbers. Western Cape has certainly got a sharp trajectory as well. Whether or not it will outstrip its second resurgence peak is not clear, but it certainly has an upward trajectory, whereas it looks like Eastern Cape and KwaZulu-Natal, although there are certainly increases in those numbers, the trajectory may well be different to the second resurgence. The other provinces of concern are obviously the Northwest province, Limpopo and Mpumalanga. Right. Again, it would appear that the trajectories there are certainly going to outstrip that. I noticed you mentioned a positivity rate, an overall positivity rate, but if you look at Limpopo, it's almost people who present, 1 in 2 of those individuals are actually COVID-19 positive. So right. That means we don't really know what the extent is of the infections in that particular province, given that the level of testing will really have to be expanded to get a better sense around that. But again, right. You've mentioned the numbers of people that are being hospitalized, and therefore the strain that's going to put on the various health systems, in particular Gauteng. I think it's really under a great deal of strain, and it's not just bed capacity, it's also oxygen supply. And the consequences of that, if our systems are frail, the outcomes can be very poor for some of our patients, yes.
I always want to get a sound understanding so there's no misinterpretation in terms of some of the phrases that we use. When you say the numbers probably have peaked in Gauteng, what does that mean?
So I think from looking at the trajectory, it would appear that that there is some decline in the numbers of cases. But I think I just want to be cautious that, very often there's variability in the numbers over the testing period, so it needs to be smoothed out. But my sense is that we probably have likely reached a peak in the numbers, and therefore the numbers are starting to decline, at least in Gauteng.
Right. So, but still relatively high, 10,770. Absolutely. Is the latest number that was released by the NICD. You mentioned the positivity testing rate. The latest numbers that we have from the NICD is that the increase represents a 28% positivity rate. Prof, at what percentage would you be comfortable with to in terms of relooking or easing the alert level 4 of the coronavirus national state of disaster? If you were advising the president, what's your thoughts on this?
Well, I think it depends on where you are in terms of the country and the levels. Again, so you really want to bring down your incidence rate below 10 or 5, 100,000, for example. So those are the types of numbers that you really want to see. We're really far above that in the current in terms of incidence per 100,000. So my sense is that we're not in a comfortable arena right now. We're still, overall, as a country, still markedly have a huge outbreak in terms of the numbers that we're currently seeing. But again, you need to disaggregate that to see where that's actually happening. And as I said, when you look at the Eastern Cape and KwaZulu-Natal, the responses there are somewhat different. Whereas, as I said to you, when you look at Limpopo, Mpumalanga, the Northwest Cape and the Western Cape and Gauteng, there's still sufficiently high positivity rates there and incidents to be of concern before making a decision. I think it's really a complex decision because, as you know, the strategy is to really look at a national level, but there may well be nuances by province. I'm not sure whether that approach may apply, but we will see when the announcements are made.
This is always this tightrope to walk, isn't it? The balancing of lives and the balancing of livelihoods. Your best educated guess, Prof, do you see us moving from alert level 4?
I think maybe with difficulty. I think, especially given the numbers and especially given the current trajectories, I think that would be a very difficult decision to say, to have some modified or lessened level of 4 or even moving back to level 3. I think really the key still, I'm afraid, is ensuring that those events, implementation of, for example, the non-pharmaceutical interventions still remain and need to be heightened in terms of really trying to ensure that the numbers coming down. So it's really around the wearing of masks, wearing them correctly, the physical distancing, the avoidance of congregant events, whether that be social events, political, or whatever events they may well be, to avoid those particular events. I think that still, in my mind, remains the core part. I think the vaccine program, again, I think there's great emphasis to roll that out. It may have some effect, maybe not to the extent that we would like to have seen, but it may well have some effect. But I think, again, encouraging people to get vaccinated, I think, is still really critical, even though it may not have a major effect now. But I think going through to the next resurgence 4 may well be important.
And now we hear about these new variants that are being found. Scientists have discovered that there is this new variant. It's called Lambda variant. By June 2021, I'm just looking at some of the research done here. The Lambda variant had begun to spread throughout South America. It was detected, I think, in 29 countries in total, especially in Argentina, Chile, Ecuador. Latest information, Prof, that you have with regards to Lambda variant, has it been picked up yet by our scientists here in this country?
So to date, when you look at the latest reports, there's no evidence for this particular variant. As you said, this variant has been in circulation for a few months now, and certainly is what we call a variant of interest. I don't think it's moved to a variant of concern. But in South Africa, as you know, we do have a network of laboratories that are looking as routinely as possible and providing results as soon as possible, normally a week to 2 weeks. There's that particular lag to provide information around that. So the current report does not indicate that this variant of interest is in circulation in South Africa.
Right. So the vaccination rollout, you spoke about it a little bit with regards to this program. It's being ramped up, which means that those in our age group, Professor, persons aged between 35 and 49, will soon be able to register. July 15th is the date, we're told. Are we on solid ground with regards to the vaccines that we currently have? Do these vaccines cover all the variants of concern?
So certainly the Pfizer, I think there's good evidence there, at least to 2 doses is quite effective in terms of preventing severe disease and hospital admissions. I think the J&J, in terms of its particular construction, may well provide protection, but I think we're looking for more evidence for that. AstraZeneca, which we don't have yet, but I'm hoping that will be relooked at and placed back into circulation, I think does show excellent efficacy against the Delta. The Sinovac is, again, of concern because, again, I don't think we have all the information we need about that particular vaccine in terms of its response to the Delta. I think there's been some preprint to show that, and by preprint I mean it's not been peer-reviewed, but at least there's some evidence, at least, that the mRNA vaccines may well be effective. But I think we need more information around that in terms of how effective it will be. And again, just your point coming back to the fact that if Lambda were to arrive here as well, getting that type of information, I think, is ongoing for us to know as we introduce different vaccines. How effective will these vaccines be against these particular circulating variants?
I've seen a statement this week from Pfizer saying that they are continuing to evaluate data from their trial while also initiating new trials in special populations such as pregnant women and children under 12. And something that's very interesting as well, they're also planning studies to assess the potential need for boosters or modified vaccine in the event that the newly emerging variants evade protection provided by the existing vaccines. Your thoughts on this?
Yes, again, it's a controversial area. I noticed the comments from FDA and CDC and various other experts with regard to the booster concept. I think that at the moment the vaccines are working quite effectively, including against Delta in the different countries. So I think the thought is, why would you want to add a booster, except for perhaps if you thought that there was declines in immunity that makes the vaccine less efficacious. But again, less effective, rather. So I think one would have to have the ability to monitor effectiveness to really make those types of decisions. And the current evidence is that you do not require boosters. You may well require them at a later phase, but at this time, one would not recommend that. And I think, again, that type of decision around a booster is not going to be made by Pfizer. It's certainly going to be made by the vaccine experts rather than Pfizer.
Because from what I read...
But I agree...
Yeah. Go ahead, Professor.
Sorry for the interjection. But again, your point about, if there are variants and it is shown that these variants, in terms of the immune escape, in terms of the vaccines, then yes, it's not necessarily a booster, but it could be argued that it could be a booster. But in SE, then you would really try and modify your vaccine to counter the immune evasion tactics used by the virus, certainly.
So you are the better mind. You can interject whenever you want. Look, from what I read and hear about these vaccines, it's all about averting severe disease. They were designed to do that, isn't it? It's a bonus if we can also prevent infection. Am I on the right, wavelength, the old thought process? Yeah.
Absolutely. Yeah, absolutely. So certainly when the mRNA vaccines were developed, that was the concern, that in fact you would prevent severe disease, but in fact that ongoing transmission would be still a problem. But I think there's evidence now to show that indeed there is certainly prevention of ongoing transmission. So I think that's another big advantage of these particular vaccines. Again, I know there's what we talk about vaccine hesitancy and so forth. So again, if you were to think of how you would contribute to your broader community with regard to protection against infection, that's another good reasons why you would want to be vaccinated.
Look, I guess the message is simple. Let us continue to be vigilant and take the necessary measures to protect ourselves as well as our families, as well as our friends. Prof, we thank you very much indeed for your time. Be well.
Yes, sir. Thank you very much for your time, too.
All right. That was the NICD's Acting Executive Director, Professor Adrian Puren there. Important story. It comes as the NCCC, the National Coronavirus Council, Command Council, is meeting today. We're going to get you the very latest. As and when we hear, we will bring you where we're going in terms of a fight against COVID-19. It's an important story, together with what's happening